Hi, I'm Dr. Patrick Andersen of Madison Maximize Living. Today we are going to cover a topic dear to many of us, and that is the subject of chronic pain, immobility, and low endurance. There is a phrase in science and healthcare that is important to know, that is, structure determines function. Practically speaking, if you have poor structure or alignment, you will waste energy, have limited movement, low performance, and low endurance throughout the day, including in your sports performance. That's why top athletes in just about every sport seek out chiropractic care for the best performance, recovery, and injury prevention. Join us in overcoming chronic pain, coming up next on Maximize Living.
Welcome back to Maximize Living with Dr. Patrick Andersen. We're talking today about overcoming your chronic pain. So first, Dr. Pat, I'd like to talk a little bit about what's the difference between acute and chronic pain. How do you know which one you truly have?
Yeah, acute pain, generally based on a time frame. Acute pain is pain that usually will go away within 3 months, hopefully much sooner than that. But once you cross that 3-month barrier with a problem, painful area that keeps bothering you, then we start calling that a chronic pain problem.
So if you're starting to get to that point, you might have some chronic pain, you want to get checked out. So when people are getting this kind of pain, where are they getting it?
Where are they getting all their pain?
Yeah.
Yeah, well, first off, low back pain is the #1 disability in the world.
Really?
Yeah. And 1/3 of all people, according to the World Health Organization, have low back pain on any given day. And 1/3 of all people have neck pain on any given day. So there's a lot of people. And as long as we're talking about 1/3, about 1/3 of people have shoulder problems. 2 shoulders, highly mobile. They do a lot of work and movement. 1 in 3 people have shoulder problems in their life. Then you get a little less frequent when you get to the hips, knees, and foot and ankle. That's about 1 in 4. 1 in 4 people would have that. So you start seeing how those numbers can overlap. And then 1 in 5, elbow, wrist, TMJ. Those kind of painful areas. So pain is related to nerves. You can't have pain unless it's a nerve being interfered with or irritated.
And with numbers that high, you might be having people that are having it in multiple areas too.
Exactly. And that doesn't even count other kinds of problems like cancer and heart disease and diabetes, sleeplessness issues. So we're not a very healthy country. World Health Organization ranked us 43rd in the world for health, but pain is the #1 problem. Is a large problem.
So with this being such a huge problem and so many people out there getting these issues, I have to wonder why, where is this all coming from?
Well, we're a high stress society, we're undermoved, we're overstressed, our nutrition isn't good, the obesity causes inflammation in our bodies. And I really think the way we take care of pain is to try to block the pain signal instead of really figure out where that pain is coming from. So for example, if you have neck pain and headaches from forward head posture and working too long on a computer, what do you still have, and you're medicated, what do you still have when the medication wears off?
You still have that forward head posture, right?
Yeah,
Yeah.
And then the neck pain comes back. So I think one of the reasons, in answer to the question, is really because we're treating symptoms and not really getting into causes. And when it comes to pain and joints, it has a lot to do with biomechanics. Structure determines function. So that's what we do as a chiropractor, is work with those structures. So some of the other things, just bad ergonomics in our workplaces, one-sided jobs, we're turning one way, we're in a hurry, we don't get good positioning. Some people just jump up and don't even straighten up before they start walking. You've seen that, they're in a hurry.
Yeah.
So those kind of things, bad mechanics, bad chairs, and so bad beds. So again, the thinking here is, oh, I have a bad back, so I better get a good chair. Or my back's bothering me, so I need a new bed.
Yeah, you hear that a lot.
Yeah.
Right.
But
And
what
people are
would be a
having to
better
sell you
thing
that
to do?
To fix the problem to begin
Fix
with.
the back,
Yeah.
and then make sure your bed is good and reasonable so you don't create that problem with that good back.
And I'd imagine too that the longer these things go on, the worse they can get. I think we've talked about it on other shows.
I like to say it gets more convoluted, more complex, because those bad firing patterns and bad mechanics start to pull in the next joint and the next joint, and they get more nerve endings involved. And in fact, you can get sprouting of the nerve endings, which will actually have more nerve endings in the skin, making it hypersensitive. That's why people will jump when you touch their back a lot of times. They have just gotten worse and worse till the skin got super sensitive.
Yikes.
Yeah.
So if you're noticing any of those symptoms, stay with us. We'll have more on chronic pain right after the break. Have your questions for Dr. Pat answered on an episode of Maximize Living. Send your email to drpat@wi57.tv. Welcome back to Maximize Living with Dr. Patrick Andersen. We're talking today about overcoming chronic pain. First, we were just kind of talking about how to recognize it so we sort of know if you're in that category. Now let's talk a little bit how we can help it, how we can start to overcome it. Let's talk about chiropractic care, because that's your area of expertise.
Yes, and people often underestimate chiropractic care. They use it as a last resort when in fact they could have used it as a first resort and prevent the problem. And that's one of the harder things in practice, is to see things that are completely preventable, not get taken care of, covered up, for example, treating symptoms, and the person gets worse and worse or degenerates joints because of it. But how the adjustment works is as we realign that spine, we change the pressure on the nerve, the interference, the traction, compression, and we change the loading of the discs, and we allow normal motion to take place in the joint. Then chiropractors will usually prescribe specific exercises to stabilize that area or to get motion in that area. So that will help heal the area. And then the proper nutrition, the proper building blocks, so that area can truly get stronger, really being concerned actually with what's wrong as opposed to just blocking the pain. So if someone comes in and say, I feel good today, I say, great, lay down, let's check your spine. Because it may not be in good alignment, and that will fool people.
So you can't
really
tell
got to fix the problem.
by how you feel necessarily.
Yeah, that's one of the most exciting things about my field is the science of it. If someone has a problem, we'll see it. Their hips will be shifted, their leg will be short, the spine will be tender, they won't move well, the muscles coming out of that area from the nerves will be weaker. And so as soon as we do the adjustment, those tests improve, so it's very quick. And there's hardly anything faster than an adjustment to relieve spinal pain. I mean, it is the most potent way of doing it. And it resets the tone and firing pattern of the nervous system. Your structure, how you hold your body, and how your nervous system fires. And there's nothing else that does that. There's no pill, no stretching, no Pilates, no massage. And all those things can be very good, but they don't have the potency to reset the nervous system like an adjustment does.
Wow, and nothing affects your entire body, your entire self, like the nervous system.
Yes.
I mean, that's every system in your body, really, you're affecting there. So how else can chiropractic help? What are some of the other important effects that it might have?
Well, besides reducing pain, it improves posture. So as soon as you align that spine, your brain is more connected, and then you'll sit up better. It increases your range of motion because joints out of alignment can't move right. They're blocking movement. It'll improve your strength, which is really fun. People just are amazed that they come in, they can't hold their head up. We give them an adjustment, and they can hold their head up against much more resistance.
Just like that, right away.
Yeah,
That's what's
as soon as that nerve works,
it.
it's firing at 270 miles an hour. It's fascinating. Body's wonderfully made, and we just need to remove that interference. It improves endorphins. Endorphins get a huge boost when we adjust the neck. It's the highest concentration of endorphins in the body. It improves sleep, balance, brain circulation itself. People with moderate neck pain have 20 to 35% less brain blood supply. And chronic neck pain, severe neck pain, 30 to 45% less brain blood supply. So as we remove that neck pain, they get better brain blood flow.
Wow.
Which is kind of important.
Yeah.
Plus, the most important thing is that adjustment just stimulates and wakes up the brain, and it reconnects. It's like a reset button on a computer. It just resets the brain, and your body functions much better again. And even boosting immunity. The nervous system and immune system are inextricably tied. So as we adjust, there's less stress on your system, and the immune system flourishes and functions much better. And even improves, has been shown to improve cognitive functions, your thinking processes and your memory, as you get all that stimulation working. Let alone the spinal cord pumping down the fluid down the spinal canal the way it should.
Wow, it just sounds amazing. It just affects your whole body.
It's really a health secret that people don't realize.
that it can do so much for you. Well, stay with us. After the break, we're going to talk about some of those adjustments that you could do. Have your questions for Dr. Pat answered on an episode of Maximize Living. Send your email to drpat@wi57.tv. Welcome back to Maximize Living with Dr. Patrick Andersen. We're talking today about overcoming your chronic pain. So you're talking before the break about the benefits of chiropractic adjustment, and I think you've probably sold a lot of people maybe that were on the fence about it. It's just amazing
Well, really,
how much it can do
people
for
don't
you.
understand the depth of what we really do. It is a full-time, lifetime career to become masterful at examining and adjusting every joint in the body.
And it's definitely something worth checking out. So let's talk a little bit more about it. Let's get into a little more detail. What are some different types of adjustments that you can do?
There's a lot of different ways. Every person is different. Not everybody gets the same adjustment. Roll on your side this way, roll on your side that way. And when someone's like on their side on a side posture adjustment, there's 20 different joints we could be adjusting in certain ways.
It's an art and a science.
Yeah, and a philosophy.
And a philosophy,
yes,
yeah.
Exactly. So there's different forces, different speeds, different angles. But there's also a drop table technique where we will cock a table up a little bit, and when the table drops down, then when it drops and hits bottom, it's a very gentle way to do it, but it'll shear force and set the joint that way.
Wow.
When we use a handheld instrument. The one I like is called an arthrostim, and it'll fire 6 cycles a second and actually jiggle a joint in place. And every person responds differently, and every type of technique makes a difference. And then of course there's about 150 different extremity adjustments. So to be masterful at all those is a full-time job.
So definitely you want to go to an expert for something like that. What are some things people can do at home if they want to kind of get started on this?
Yeah, first off, I would pick up the phone and call us, 833-1282, because it can't really do it all alone. But when you combine home care things with the adjustments, you get your best results. We often say that doing the exercises, using what we call our home care kit, making some nutritional changes, add 30, even 40% to your overall speed of recovery and potential to recover. You know, keep in mind that some people have chronic permanent injuries and they don't know if they can get any better at all.
Right.
But when you use every tool available, you can often make changes they never thought they could get.
So definitely something worth checking out. And to maximize living just in general, you can do a lot for people, a lot more just in all areas of their lives. What are some things that you can do there to help?
Well, just the instruction, the education. Choose chairs and better chairs. Make sure you're not slumping and sitting low with your knees up too high. Mm-hmm. Make sure you're moving, you know, and start to learn more about things like anti-inflammatory foods. And there's things called spinal molding where we put rolls under your neck and low back to mold the proper curves in.
Right, we've checked that out on the show too. It's quite comfortable actually, yeah.
But some of the things we do at Maximize Living that I think are unique is that we do muscle strength testing, which really tells you if the nerve is functioning well. We measure our x-rays, which is a lot of work, but it tells you the best possible way to adjust somebody. We do what we call a doctor's report, where we spend 20-30 minutes going through those x-rays and exam findings and developing a plan of care with the patient. And then probably one of the other big things I think we do well in our clinic is the progress exams. Because if you are getting adjusted, you're going to see changes as you go, and you can measure the progress, and the patient's pain relief usually corresponds with that.
That's fascinating too, and I like that you're following through, and it just seems like you've got this plan for people. They can see where they're at, where they're going, and they can see the progress that they're making.
And you know what else is really fascinating? People often don't feel like exercising,
mm-hmm.
don't feel like eating right, and I see it to a T. Once people start getting adjusted, they feel better, they sleep better, they're moving better, and then they say, you know, I feel like exercising now. So they start exercising. So guess what happens after they start exercising?
They start eating right.
They start saying, well, if I'm going to work like that, I just want to eat better food.
Yeah.
And so they improve the quality of their food, and it's a process like that that just improves their health. So health restoration is what we do.
So you're definitely just little by little improving your whole life. You go in for an adjustment and you come out a whole new person.
And one of the coolest things too is just how much improvement half the patients get right away. Most people will come back and say, wow, that was amazing. I feel completely different.
Yeah.
You know, at least half do. The other half take time, And
But they get
some
there.
get a little sore, some get pretty sore, but it's rare.
Yeah.
You know, when you change someone's leg length and their posture all of a sudden is different, their muscles are working differently. So, but not too many get really sore.
Well, stay with us. We'll have more on overcoming your chronic pain right after the break. Have your questions for Dr. Pat answered on an episode of Maximize Living. Send your email to drpat@wi57.tv. Welcome back to Maximize Living with Dr. Patrick Andersen. We're talking about overcoming your chronic pain today and talking about how chiropractic adjustment may be able to help you. I wanted to talk too about parents out there with children. Is this something that you should start getting your children involved in, or how do you do that?
Absolutely. The first subluxation or misalignment of the spine often starts at birth. It's a really stressful process on the child and for mom as well. And so the first subluxation starts at birth, and maybe the child won't notice too much, you think, until they start doing some things like sports or sitting at school. But really, kids have low back pain, kids have neck pain, kids have stress, kids have headaches, and don't blow it off. There's a reason for it. Kids respond wonderfully to care. Some of our favorite kids to take care of are the ones that aren't doing well in school. Their nervous systems aren't firing right. And what we do is very stimulatory, very balancing for a child.
Oh, wow.
And it's incredible to see a disconnected child with poor posture sit up and start looking in the eye and asking you questions in a couple weeks.
Wow.
That is a common thing we see.
Oh, that's got to be so rewarding
It really
to see
is.
that.
Because kids have spines too.
Yeah, and that may be the cause
They're
of some of the
developing
issues
nervous
that they're
systems,
having.
and we want it to grow right, and that helps limit adult problems. So parents, it's one of the best things you can do for your children. Just get a checkup and see how leg length and posture and motion are doing.
Wow, amazing. Something you might want to check out. Now, what are some of the some things you could say about chronic pain and chiropractic care? You know,
And
just
how it
kind of sum
works.
it up a
You
little
know
bit.
what?
Yeah.
There's two words, really. Chiropractic works.
Yeah.
And the world doesn't know it. I guess that's more than two words. But it's a
We'll give you a
fascinating
pass.
field that has really been held down, and we don't look at that. We're scientific. Well, actually, we're quite scientific in chiropractic. We measure everything.
Yeah, so definitely something to check out. Now, in addition to that, let's talk about some of the things like diet and nutrition, because we talk about that a lot on the show too, how that can maybe help.
That people all have this SAD diet, standard American diet, is really inflammatory. So our omega-6, omega-3 ratios are off, bad fats, trans fats, and that causes inflammation and contributes to chronic pain. This is where many people who switch their nutrition can help themselves in their chronic pain at home.
Wow, so that's something that you might be able to just take care of, or just a little bit with your diet and nutrition.
Yeah, add to it. It really does make a difference.
And let's talk a little bit about exercise too, because I feel like those two sort of go hand in hand.
They really do. Joints in pain are usually stagnant, fixated, have adhesions. They're not moving. So they just stagnate, and waste products build up in the area and cause more noxious chemicals to irritate nerve endings. So when you're moving, getting things working, you move those waste products out of the area and you have less pain. Motion moderates pain, helps reduce it.
And I think too that's just, we've talked about on the show, we're meant to move, we're meant to do these
Motion is
things.
life.
And your body's going to react positively to that if you're doing the right types of things.
Yeah, and what some people do with that, I have arthritis, I better not move, it'll make it worse, and it's absolutely different than that. Move the right amount. Obviously you can overdo it and make it worse, but sometimes underdoing it is worse than overdoing it.
So let's talk a little bit more about some of the things you've seen at Madison Maximize Living.
Well, we see a lot of people in chronic pain, people that have been all over the place, every test under the sun, and that they've never had their spine checked. So when we get to check them, it's really kind of exciting, and they're excited too, because when I show an inch short leg and forward head posture of 2 inches and show them in a mirror where their shoulders 2 inches higher and how they can't turn their head or tilt it back, and they can't hold their head up in the air, their legs up in the air, you can do something about that?
Like,
Yes,
oh yeah, we
yes.
can. Wow.
And as we do, you'll probably start feeling better, because these joints are all torqued and distorted. They're sending bad signals to your brain and stressing your brain, and it fatigues you. So as we do our work, your body restores, you get more power, more motion, more strength, and start sleeping better, and you start feeling like you're a new person again.
Wow, that's really amazing. Well, stay with us. We'll have more on chronic pain right after the break. Have your questions for Dr. Pat answered on an episode of Maximize Living. Send your email to drpat@wi57.tv.
Thank you for watching our show on chronic pain, immobility, and low endurance. After watching our show, I think you'll agree that structure determines function and that there is a lot that can be done to improve your health naturally without drugs and surgery. The only way to really know if your structure is functioning properly is to have a chiropractic checkup. To help be your best, give Maximize Living a call at our office at 608-833-1282 and schedule your checkup today. For Maximize Living, I'm Dr. Patrick Andersen. Until next time, live well and God bless.
Have your questions for Dr. Pat answered on an episode of Maximize Living. Send your email to drpat@wi57.tv.